Sponsored by Doctors Implants, home of the 6-hour smile.
Well, a controversial new Texas order is going into effect. As of yesterday, hospitals across the state will be required to ask a patient about their citizenship status. Immigration advocates are concerned as hospital systems work to understand these new requirements. The executive order from the governor makes it very clear hospitals are to tell patients that their response will not affect their care, especially during emergencies. And the reason why this is even happening has to do with data. Back in August, Governor Greg Abbott signed this executive order requiring doctors and nurses to ask people who need inpatient or emergency care if they are a U.S. citizen or not. Abbott says he wants to collect data on the cost of caring for undocumented patients. He claims Texas absorbs a large percentage of the costs associated with medical care for those who are not lawfully in the U.S. The order law doesn't say if patients legally have to answer this question, and local hospitals are stressing to people if they prefer not to answer or don't know their status, they will not be denied medical care.
Hospitals are going to do the right thing. And even if someone presents at the emergency room and it's a true emergency, we're going to treat them regardless of their legal immigration status, ability to pay. We're not going to change how we treat the patients. We're going to do the right thing.
And Steve Love says the new ask from hospital staff involves one question on citizenship, and that hospitals have worked with their staff and legal counsel to make sure that they're asking that question appropriately and reporting the data correctly. Still, critics like the American Civil Liberties of Texas says the order has created fear among these communities. The state health department has responded, saying that people should not be discouraged from seeking health care because the purpose of this law is only to gather data. Now, hospitals will have to report back that data to the state by March of next year.